Hello everyone. I am here to report about the ketones. So we have here the chemical examination of urine in ketones. So the term ketones represents three intermediate products of fat metabolism, namely, first, acetone that has 2%, number 2, acetoacetic acid that has 20%, and B, hydroxybutyrate that has 78%. Normally, the measurable amounts of ketones do not appear in the urine because all of the metabolized fats are completely broken down into carbon dioxide and water. However, the use of available carbohydrates as the major source of energy becomes compromised, and the body will store fats to metabolize to supply energy so that ketones are then detected in the urine. So the clinical reasons in ketones is that the increase of fat metabolism includes the ability to metabolize carbohydrates as occurs in diabetes mellitus because of what? Because of increased loss of carbohydrates from vomiting and inadequate intake of carbohydrates associated with starvation and malabsorption. So we have here an example of deficiency in insulin na makikita natin sa type 1 diabetes mellitus. So this deficiency indicates the need to regulate dosage and ketonuria is an early indicator of insufficient insulin dosage in type 1 diabetes and in patients with diabetes who experience medical problem. So, if nag-increase ang accumulation of ketones in the blood, it will lead to electrolyte imbalance, dehydration, and if not corrected, acidosis and eventually diabetic coma. So ano nga ba ang ginagamit ng mga hospitals laboratories to test those ketones? So we have here the multiple test strips. So this test will identify the patient's illness either to prevent adequate intake or absorption of carbohydrates and produces accelerated loss in the case of vomiting. So by means of this, they can monitor patients that has ketonuria. So in the reagent strips, this is to measure ketones. So in this reaction, acetoacetic acid in an alkaline medium reacts with sodium nitroprusside to produce a purple color. So as you can see here, this is an example in the table kung paano nila tinitest ang ketones in the reagent strip reaction. So in as much as these compounds are derived from acetoacetic acid, their pressure can be assumed and it is not necessary to perform individual tests. Okay, so how will you report those results as qualitatively? So in ganito, negative, then trace, or small 1+, and then moderate 2+, or large 3+, and then sa semi-quantitatively naman as negative, trace, we have 5 milligrams to dl, and then small, then 15 milligrams to dl, and then moderate from 40 milligrams or dl, or large is from 80 to 160 milligrams or dl. So this is the principle in the urine ketone test. We have here the acetoacetate and acetone plus sodium nitroprusside plus glycine that is equal to purple color. Okay. We have here the reaction interference. Okay. Large amounts of levodopa. When we say levodopa is also known as idopa, and it is an amino acid that is made and used as part of the normal biology of some plants and animals, including humans. So the color development from acetoacetic acid increases that will result in false positive result from improperly timed readings. So kung mugawas daw ang iyahang if makuan sa improperly timed readings. And we can get a false decrease values due to volatilization of acetone and the breakdown of acetoacetic in improperly preserved specimens. So, katong dito sa color development, makakuha ta og false positive result if makakuan ta sa improperly timed readings, and then mag-decrease pod ang values of volatilization kung makuha na siya dito sa improperly preserved specimens. Okay, now for the last slide that we have is about the acetase tablets. However, acetase tablets has been used as a confirmatory test for questionable reagent strips result. This is used for testing serum and other bodily fluids for severe ketosis. However, this was primarily used for testing serum and other bodily fluids and dilutions of these fluids for severe ketosis. So, but currently, as the time goes by, nadaghan na kay sila na develop na new other methods. We have these new methods measuring B-hydroxybutyrate using reagent strips that have been delivered to provide automated methods for testing serum and other body fluids. So, sa unang panahon, nagagamit sila og katong mga old methods, pero kumbaga murag dugay mga bot ang mga results ba. Ana good. No, not unlike karon sa mga new methods na automated na siya, so mapadali na lagawas ang result. So the acetase tablets are hygroscopic. When we say hygroscopic means tend to absorb moisture from the air. So when the specimen is not completely absorbed within 30 seconds, a new tablet should be used. That would be all. Thank you and God bless.